All right, this next segment is for the ladies. When was the last time you sat down and really talked to your gynecologist? Well, you should check in because there are so many new technologies out there that are improving women's health, as we learned from our chat with EvergreenHealth. What services does the EvergreenHealth Women's Specialty Care Gynecology provide to the women in our community?
So our department is a very specialized department that focuses on a few conditions that women deal with in terms of their gynecologic and reproductive organ. We look at conditions like abnormal uterine bleeding, endometriosis, painful periods, pelvic prolapse, and fibroids. And we can treat these both with medications, but also with surgical interventions. So things like hysterectomy, myomectomy, which is removal of the fibroids from the uterus, prolapse repair, which is to help elevate the uterus. The main focus of my practice is what is called as an excision of endometriosis, which is where we can go in and remove endometriosis from patients who are suffering from this horrible disease. The advantage of the approach that we use is we use something called minimally invasive surgery, which is basically surgery that is done through tiny incisions, which means a much faster recovery, less pain, and less bleeding.
Which is great. Can you define, for some who may not know the term endometriosis, what it is?
Yeah, absolutely. So endometriosis is this chronic condition that actually 1 in 10 women deal with in the United States. It is a condition whereby you can have very, very painful periods. It can have a huge impact on your quality of life, your ability to go to work, your ability to go to school, your relationships. In fact, a lot of women suffer with this silently because they're told for years that painful periods are normal. Painful periods are something you just have to deal with. Most women have a delay of diagnosis for about 8 to 12 years. Painful periods are not normal, and we can help. We can help resolve these issues.
Yeah. Now, I do have a question. I want you to clarify for me the difference between Evergreen Healthcare Women's Specialty Care Gynecology versus Evergreen Health's other women's care practices, or such as an OBGYN.
This practice, the Evergreen Health Women's Specialty Care Gynecology, focuses primarily on patients that have these conditions and the high volume surgical interventions we can use to help these patients recover and improve their quality of life. Now, we don't do any obstetrical care. And so while I previously did deliver babies in the past, and I certainly love delivering babies, that's something that I'm going to leave in the qualified hands of my wonderful colleagues in the other Evergreen Health practices. Our focus is really going to be on taking care of the complex surgeries to manage these complex pelvic conditions.
Will you do me a favor and walk me through the process a little bit, just so me and other women know? So first stop is the OB/GYN and then come see you. Like, when do we know it's time to come to specialty care?
Specialty care is going to be for patients that have painful periods, heavy periods, irregular periods, prolapse. And so if at any point you feel like you have one of these conditions, you can certainly schedule an appointment either through our website or by calling our office directly. You can talk to your primary care provider and say, hey, I think that I have these gynecologic conditions that I need to see a specialist for. Or you can talk to your OBGYN.
What is like the first step there?
Patients can either self-refer through our website or by calling our clinic, or they can ask for a referral through their primary care provider or through their regular OBGYN. Once they come to me, the first thing we do is we essentially have a consultation visit, and we sit there and we just talk. I listen. I want to hear about what is the condition that has been bothering you? How long has it been bothering you? Tell me about all the other symptoms that you've been experiencing, because it's really, really important. A lot of these women deal with these conditions for years before they can finally actually see somebody who will just listen to them. And so once we do that, then we move forward with, okay, what are the different treatment options that are available? Is surgery the right thing for you? It's not always the right thing for everybody, but if it is the right thing for you, how can we do that expeditiously and safely so that you can return to your quality of life?
Yeah, the specialty care is really, really a blessing. My sister dealt with endometriosis for 10 years before it was finally diagnosed. And so I'm really glad we're talking about this with you. Is there anything else that I have missed that you need to share about the specialty clinic?
I think the big important message that I'm trying to send is this is a new clinic that we're establishing because there really is a need. There's a lot of women in our community who suffer from these conditions on a daily basis. And there just isn't enough education out there for these women to be able to get access to. And so my goal is come to the clinic, talk to us, and by the time that you leave the appointment, my goal is all of your questions are either answered or we have a plan in place to be able to get you on the right path.
All right, so if you want to learn more about what we discussed today or get in contact with Evergreen Health, maybe get some questions answered, please visit the website on your screen. We've also got a link on New Day's website. It's important to talk about, especially with your doctor. Well, now that Halloween is over, our eyes are focused on Thanksgiving. Up next, what's happening with this year's iconic Macy's Thanksgiving Day Parade. Stick around.
This portion of New Day Northwest is sponsored by EvergreenHealth.